What if the key to taming your diabetes isn't just cutting sugar, but something hiding in your pantry? Let me tell you about Sarah. She'd done everything right. Cut out desserts, walked daily, took her meds, but her energy still crashed by noon. Her hands tingled. Her blood sugar swung like a pendulum. Then her doctor asked one unexpected question. When's the last time you checked your vitamins? Turns out Sarah was missing four critical nutrients most diabetics never think about. Without them, insulin struggles, nerves fray, and fatigue becomes a default setting. But once she fixed this gap, her A1C dropped. The tingling faded. She finally felt in control. Let's break down these four game changers and how to get them right. 1. Vitamin B6, the nerve guardian. Vitamin B6 is often underrated, yet for individuals with diabetes, its role is vital. Elevated blood sugar levels speed up the loss of B6 because your kidneys excrete it alongside excess glucose. In addition, the inflammation and oxidative stress common in diabetes prompt your body to use more vitamin B6 for repair. High insulin levels can also disrupt how B6 is metabolized, reducing its availability for cellular functions. To complicate matters, medications such as metformin and certain blood pressure drugs can further deplete B6, leaving many diabetics deficient without realizing it. 2. Recognizing the signs of B6 deficiency. A deficiency in vitamin B6 might not present obvious symptoms at first. You may experience unusual tiredness, brain fog, or mood fluctuations. One key indicator is nerve discomfort, tingling, burning, or numb sensations in the hands and feet. Muscle weakness or poor coordination can occur too, given that B6 is crucial for proper nerve and muscle operation. Other symptoms might include dry or irritated skin, recurrent mouth sores, and a compromised immune system. In severe cases, anemia may develop, leading to dizziness, pallor, and shortness of breath. 3. How B6 influences multiple systems. Vitamin B6 affects several body systems. Reproductive health. In men, low B6 can lower testosterone levels and impair sperm quality, while in women it may cause irregular menstrual cycles and worsen PMS symptoms. Mood and brain function. B6 helps regulate neurotransmitters like dopamine and serotonin, which play key roles in mood and energy, meaning its shortage can contribute to anxiety and depression. Nervous system. Adequate B6 is necessary for nerve repair and protection. Without it, nerve damage can intensify, leading to increased pain and slower recovery. Kidney health. B6 is important for combating inflammation in the kidneys, so low levels raise the risk of kidney complications. Eye health. B6 protects the delicate blood vessels in the retina, and insufficient amounts may accelerate diabetic retinopathy, potentially affecting vision. Cardiovascular health. By lowering homocysteine, a harmful amino acid, B6 helps maintain healthy blood vessels, reducing the risk of high blood pressure, heart attacks, and strokes. Glucose metabolism. B6 plays a key role in breaking down glycogen, ensuring a steady release of energy. Without enough B6, blood sugar control worsens and insulin resistance can increase. 4th, dietary sources of vitamin B6. The best way to ensure you get enough vitamin B6 is through your diet. For example, chickpeas. 1 cup of cooked chickpeas provides about 55% of your daily B6 requirement. Beef liver. A 100-gram serving supplies roughly 50%. Wild-caught salmon and turkey. Each offers around 40% per 100-gram serving. Sunflower seeds, an ounce 28 grams, provides approximately 30%. These foods not only help maintain B6 levels, but also support nerve function, immunity, and metabolism, which are particularly beneficial for diabetics. For a gourmet twist, consider dishes like a Japanese-style glazed salmon with chickpeas. 180 grams of salmon with 1/2 cup of chickpeas delivers over 90% of your daily B6. Or a French beef liver, pâté paired with roasted garlic potatoes. 100 grams of liver plus 1 medium potato offers about 85% of daily B6. A Mediterranean chickpea and grilled lamb stew with saffron, 200 grams of lamb and 1 cup of chickpeas, can provide around 80% of the daily requirement, along with essential amino acids for muscle repair and immune support. 5th, supplementing when necessary. If diet alone doesn't meet your needs, supplements can bridge the gap. Bioavailable forms like pyridoxal 5-phosphate, P5P, are particularly effective because they are immediately usable by your body. For instance, products offering around 33 to 50 milligrams per capsule are popular choices. While most diabetics do well with 25 to 50 milligrams daily, It's advisable to consult your doctor before increasing the dose. 6. Habits and foods that worsen B6 deficiency. Some lifestyle choices can exacerbate a vitamin B6 shortage. Refined grains, processed foods like white bread and pasta lose much of their B6 during processing. High sugar diets. These diets can accelerate B6 depletion due to insulin spikes. Alcohol consumption. Alcohol interferes with B6 absorption and speeds up its breakdown in the liver. Certain medications. Besides metformin and blood pressure drugs, birth control pills can also reduce B6 levels over time. In summary, while vitamin B6 might not always be in the spotlight, it's a critical nutrient for those with diabetes. It improves insulin sensitivity, protects nerves, supports cardiovascular health, and helps maintain stable energy levels, making it an essential component of effective diabetes management. Shidori 2, vitamin C, the collagen architect. Vitamin C often doesn't get much attention until it's in short supply. But for people with diabetes, deficiencies can occur more frequently than expected. Elevated blood sugar levels accelerate the depletion of vitamin C because both glucose and vitamin C use the same cellular entry route. When blood sugar is high, vitamin C struggles to be absorbed efficiently. Additionally, increased oxidative stress in diabetics means the body requires extra vitamin C to combat cellular damage. Since vitamin C is water-soluble, frequent urination further depletes its levels. At first, the signs of low vitamin C may be subtle. Constant fatigue can be a clue, as vitamin C is key to cellular energy production. You might also notice that you bruise easily or that wounds heal more slowly, suggesting insufficient collagen synthesis, a process heavily dependent on vitamin C. Other early indicators include bleeding gums, dry or irritated skin, and a tendency to get sick more often. Joint pain and stiffness may worsen too, as vitamin C helps safeguard cartilage from degradation. In more extreme cases, a deficiency can lead to iron deficiency anemia, resulting in dizziness, weakness, and pale skin. The impact of inadequate vitamin C spans multiple systems in the body. It plays a protective role for reproductive cells, aiding sperm production and motility in men, and supporting ovulation and hormonal balance in women, which means low levels can hamper fertility. A drop in vitamin C can also lower libido, as it helps maintain healthy blood circulation essential for sexual function. Diabetics already at an increased risk for nerve damage may experience aggravated neuropathy when vitamin C levels are low. The kidneys, too, depend on vitamin C to fight inflammation and oxidative stress, so insufficient amounts can elevate the risk of kidney issues. Vision can also suffer because vitamin C protects the delicate blood vessels in the retina. The cardiovascular system is perhaps the most affected. Vitamin C keeps arteries supple, reduces inflammation, and helps prevent plaque buildup. Without it, blood vessels can become rigid, blood pressure may increase, and the likelihood of heart disease and strokes rises. On a cellular level, vitamin C acts as a powerful antioxidant. It lowers oxidative stress, a major contributor to insulin resistance, and aids in collagen production, which is essential for strong blood vessels, healthy skin, and effective tissue repair. It also boosts the immune system by supporting white blood cells and rejuvenates other antioxidants like vitamin E, reinforcing your overall defense mechanisms. Without enough vitamin C, cells can become inflamed, age prematurely, and function suboptimally, hastening the complications of diabetes. Fortunately, it's easy to replenish vitamin C through diet. Some of the richest sources include cockatoo plums, where just 100 grams can provide over 3,000% of your daily needs, and acerola cherries, which offer about 1,600% per 100 grams. Red bell peppers supply roughly 200% per 100 grams, while kiwis deliver around 150%. Strawberries, too, offer a good amount, about 90% per 100 grams, along with extra fiber to help regulate blood sugar. For gourmet enthusiasts, there are elegant dishes that pack a vitamin C punch. Imagine a tropical ceviche featuring fresh kakadu plums or citrus-marinated salmon with red bell peppers that supplies over 2,000% of your daily vitamin C in a 150-gram portion. A Japanese yuzu-infused tuna tartare with kiwi salsa can provide more than 1,000% per 180-gram serving, and a French-style acerola cherry sorbet with dark chocolate shavings, 120 grams, offers over 800%, satisfying sweet cravings without spiking blood sugar. When food sources aren't enough, supplements can help, but not all forms are equally effective. Liposomal vitamin C is a top option due to its enhanced absorption into the bloodstream. For example, products offering 1,000 milligrams per serving are popular for their rapid uptake. Alternatively, ascorbic acid capsules at a dose of 1,000 milligrams can also be effective. Most diabetics typically benefit from 500 to 1,000 milligrams per day, though during illness or periods of high oxidative stress, a higher dose may be advisable. It's also important to be mindful of factors that can worsen a vitamin C deficiency. High sugar intake can block vitamin C from entering cells, while alcohol consumption depletes vitamin C stores and increases oxidative stress. Cooking vegetables at high temperatures can destroy much of their vitamin C, so lightly steaming or consuming them raw is preferable. Smoking further accelerates the loss of vitamin C, and diets heavy in processed foods often lack the fresh fruits and vegetables necessary to maintain adequate levels. Overall, vitamin C is one of the most straightforward and effective nutrients for boosting your immune system, improving insulin function, and protecting heart health. Ensuring you get enough vitamin C, whether through a nutrient-rich diet or high-quality supplements, can help prevent complications like neuropathy, kidney disease, and vision loss. If you're experiencing frequent infections, slow healing, or persistent fatigue, a vitamin C deficiency might be a contributing factor. 3. Vitamin E, the silent shield. Vitamin E acts as your body's innate shield, safeguarding cells, nerves, and blood vessels. However, in people with diabetes, it's depleted more rapidly. Elevated blood sugar increases oxidative stress, compelling your body to use extra vitamin E to counteract damage. Moreover, because vitamin E is fat-soluble, it requires healthy fats for proper absorption, and diabetes can impair fat metabolism, making it tougher to keep levels optimal. Subtle signs of deficiency. A shortage of vitamin E often doesn't reveal itself through overt symptoms. Early hints may include muscle weakness or difficulty with coordination, as vitamin E is vital for smooth nerve communication. When its levels drop, you might experience worsening numbness, tingling, or burning in your hands and feet, which can intensify neuropathic pain. Other indicators include dry, irritated skin that heals slowly, vision issues like trouble seeing in low light or increased eye strain, and a more frequent occurrence of illness due to its role in immune support. Boosting vitamin E naturally. Enhancing your vitamin E intake through diet is a natural strategy. Sunflower seeds, just 28 grams, provide about 66% of your daily requirement. Almonds, 1 ounce, delivers roughly 48%. Hazelnuts offer around 28% per ounce, making them a convenient snack. Cooked spinach. A cup provides about 20% of the daily intake. Avocados, 1 medium fruit, contributes around 15%, along with healthy fats that aid absorption. For those who appreciate gourmet cuisine, consider high-end dishes that pack a vitamin E punch. A Mediterranean grilled sea bass with an almond herb crust, 180 grams of fish with 1/4 cup of almond supplies over 70% of your daily needs, while adding heart-healthy omega-3s. A Japanese-style roasted duck breast with a hazelnut miso glaze. 200 grams of duck with a 1/4 cup hazelnuts provides about 65% of the required intake. A French avocado and sunflower seed tartar with truffle oil. 150 grams of avocado with 2 tablespoons of sunflower seeds delivers roughly 60% of your daily vitamin E. Supplement options and considerations. If dietary intake isn't enough, high-quality supplements can fill the gap. Natural forms like D-alpha tocopherol are better absorbed than synthetic alternatives. Options such as pure encapsulations vitamin E, 400 IU per softgel, or Now Foods vitamin E, 400 IU per softgel, are excellent choices. Typically, a daily dose of 200 to 400 IU is sufficient for diabetics, though it's important to consult with your doctor since too much vitamin E can thin the blood. 6. Habits that can exacerbate deficiency. Certain habits and foods can worsen vitamin E depletion. Processed vegetable oils. Oils like soybean and corn oil heighten oxidative stress and lower vitamin E levels. High intake of refined carbohydrates and sugars. These foods trigger inflammation, causing your body to use up vitamin E faster. Excessive alcohol. Alcohol can damage the liver, reducing its ability to store and utilize vitamin E efficiently. Low-fat diets. Without adequate healthy fats, vitamin E absorption suffers. Overcooking vegetables. This practice can destroy much of the vitamin E content, so it's best to lightly steam or eat them raw. In summary, Vitamin E plays a crucial role in defending against diabetes complications. It enhances insulin function, protects nerve health, maintains the flexibility of blood vessels, and reduces inflammation. If you notice your blood sugar control worsening, increased nerve pain, or drier skin, you might be running low on vitamin E. Boosting your levels through nutrient-rich foods or supplements can improve circulation, strengthen your immune system, and help your body better withstand diabetes-related challenges. 4. Vitamin D, the sunshine switch. Here's the twist: 80% of diabetics are low in D. It's not just a vitamin, it's a hormone that directs insulin to work. Sarah's fatigue? Her cells were starving for D's open up signal to let glucose in. Fix it. Catch 15 minutes of sun daily, no sunscreen. Eat fatty fish like mackerel, 90% DV per fillet, or fortified mushrooms. Supplement with D3 plus K2. They're a dynamic duo for directing calcium to bones, not arteries. The hidden saboteurs. Sugar binges drain B6 and C. Low-fat diets starve E and D. Night shifts or sunscreen block D synthesis. Sarah's turnaround started when she added these four to her plate. Her nerves calmed, her energy surged, and her doctor stunned. If your diabetes feels like a puzzle, hit subscribe. We're here to help you find the missing pieces.